of UN Women. And then to her left is Papa Sek.
We had these rates affirming that 1 in 3 women, they continued facing suffering physical and or sexual violence. And most of these forms of violence, they have been experienced by their own intimate partners. And this day was just the tip of the iceberg, because these rates do not include sexual harassment or violence in digital contexts, harmful practices, sexual exploitation, etc. And even worse, we do know that such violence against women and girls is one of the most underreported crimes because of stigma and because of lack of confidence to authorities.
And they're here to present.
Almost 1 in 2 women reported that they or a woman they know experienced a form of violence against women since the pandemic began. Exposure was highest amongst women in Kenya, Morocco, Jordan, and Nigeria, while those in Paraguay were the least affected by reported such experiences. Overall, 1 in 4 women reported that violence against women most commonly experienced is verbal abuse or denial of basic resources.
And if I may, I was wondering if I could ask.
Looking at specific age groups, women who are most vulnerable, we see that younger women aged 18 to 49 years of age were the most affected population, but also women who are employed during the pandemic. The findings reveal that 1 in 4 women are feeling less safe at home as conflict has increased within households during the pandemic. And when women were asked why they felt unsafe at home, they cited physical abuse as one of the reasons.
The rise to violence to COVID.
Outside of their homes, women are feeling less safe as well, with 40% of respondents saying that they feel less safe walking around alone at night since COVID began. About 3 in 5 women also think that sexual harassment in public spaces has gotten worse since COVID-19.
Again, we will not have another briefing till.
UN Women put forward some policy recommendations, including putting women at the center of policy responses, allocating enough resources to address violence against women in recovery and response plans, strengthening services for women who experience violence, investing in medium and long-term prevention efforts, and really ensuring that gender statistics and sex disaggregated data are collected regularly, such as these surveys that we just conducted to measure the impact of COVID-19.
Any questions? And we'll update our highlights that day.